CoxHealth announcing it's closing the labor and delivery unit in the Monett Hospital. They say it's due to a shortage of doctors. Now mothers will have to travel to receive care and deliver their babies. Caitlin Schumacher joining us live this morning. She spoke to a few moms about their concerns. Caitlin?
Good morning. Now, the country is facing a maternity care crisis, and now that crisis is hitting a little bit closer to home. So take a look at this map right here. This shows the areas where there are high levels of maternity care, but it also shows places that are maternity care deserts or areas that don't have any access to maternal care. Now, when the Cox Monett Hospital closes its labor and delivery doors, Berry County will become one of those deserts. Now, several moms voiced their disappointment and concerns, and I sat down with a few of them to hear what they had to say.
It just sucks. It really does.
It's devastating.
Like, I was shocked.
Many new and expecting moms were caught off guard when they saw the announcement that the Monett Labor and Delivery Unit would no longer be serving patients this summer. Taylor Haney is expecting her third baby in August and will now have to drive 45 minutes to Springfield for her weekly appointents and delivery.
It's going to be pretty difficult. I work a full-time job, and I'm also a mom. My fiance works, so we share one vehicle, so it's going to be hard to schedule appointments, go 45 minutes to an hour, sit there for an hour, schedule around work and everything else.
An inconvenience many women in rural communities face. According to a study by the March of Dimes, 54 Missouri counties have no access to maternal care or birthing centers. Expecting moms have to travel to the nearest hospital, and that can be scary.
I was in active labor for 20 minutes. So, I mean, if I had to go to Springfield, I don't know if I would have made it.
Jade Morphin had her daughter in December. The distance wasn't the only challenge her and her husband had to face.
There was this big snowstorm, I'm sure you remember, and it was bad.
Bethany Fisk says that she felt safer having care closer to home.
Because this is my first baby, I didn't know what I was doing. It was nice to be able, like, if I had to go in, it's a 10-minute drive, 15-minute driving.
We reached out to Cox for an interview, and they issued a statement that says, Cox Monett has made every effort to avoid the maternity care crisis. With a national shortage of physicians, it has become even more difficult to recruit obstetricians and family practice physicians to rural areas. Now, Mercy does have a hospital in Aurora with a labor and delivery unit, but it is out of network for some insurances, and some of the expecting moms that I talked to said that they just prefer to use Cox. So you can take a look at Cox and Mercy statements that were issued to us at ky3.com and the KY3 News app.
Caitlin.